Welcome back, everyone. Tonight in Medical Rounds, beyond the illness itself, coronavirus has done damage in many ways. And one of the troubling statistics related to COVID is the increase in alcohol consumption, especially among women. Here to talk about the reasons why women are more likely to struggle with alcohol use is Dr. J. Craig Allen, Medical Director of Rushford with Hartford Healthcare. Thank you so much, Doctor, for being with us.
Thank you, Aaron. Thanks for having me.
So what exactly are the statistics regarding an uptick in alcohol use during COVID, specifically for women?
Yeah. So during COVID, we've seen things that are similar to other major events like 9/11 and Hurricane Katrina, an increase in drug use and alcohol use. And these huge sales, online sales of alcohol, 300%. What we've seen overall with alcohol, increase in alcohol use in the general population is 14%. But what we've seen with women is an increase of 40% in a certain type of drinking, heavy drinking or binge drinking. And that's having more than 3 drinks in a short period of time. And that's a pretty dangerous practice. We're very concerned about it.
Obviously, that is very alarming to hear. What do you think has triggered this increase?
Well, there are 3 different things that I look at here as being part of this. One is there's a difference in why women drink generally versus what drives men to drink. And for women, it's can be a way to deal with difficult emotions and stressful circumstances, whereas for men, more of a social setting or celebration. And during COVID, women have been disproportionately affected by the loneliness and the symptoms of stress and anxiety and depression, as well as the caregiver load. Women are 3 times more likely to have to take care of a child and by themselves than men. And also economically, women are twice as likely to lose their jobs. So those are some of the things that are driving this. And the concern is that women are more susceptible to developing alcohol use disorder and the related physical problems, more susceptible than men. If they drink the same amount, women are the ones that have the problems. So we're very concerned about this. The numbers with women drinking have been going up for the last 10 years, and this isn't going to help. This is concerning.
Yes, it is. And there are probably people at home right now watching this saying, am I drinking too much? When should someone be concerned that they may be doing more than just harmless recreational drinking?
If you're drinking to try to fix something or to try not to feel things or to address a certain situation, then think twice about it. The NIAAA, that's the National Association of Alcohol Abuse, says that for women, more than 7 drinks a week is risky business. And as I mentioned earlier, more than 3 drinks in a setting greatly increases your risk of developing problems with alcohol use disorder.
Lastly, doctor, and briefly, if you could, what resources are available to folks at Hartford Healthcare?
Well, there's the Hartford Healthcare Care Connection line, and there's the Rushford Intake Services, and we have many services available both in person and virtually to address this, to assess this, and to help people get themselves into a situation where they're not at risk.
All right, Dr. J. Craig Allen from Hartford Healthcare, thank you so much for being with us tonight. I think your advice is very timely and probably very helpful to people watching.